Hello, Pete here. Today I'm talking about massage for runners, and today we're going to focus on the lower leg. I'm just going to show a few different examples of how massage therapists like myself would treat the lower leg, specifically in athletes like running, but this is the type of work we could do for all kinds of clients. So what we'd start with usually is some type of assessment, discussion with the client to see where the tight spots are and if they're having pain. So an assessment might look like this. Testing to see where the foot lies naturally in a resting position to indicate where the tightness comes in at different angles of the foot and the ankle. Another thing we might do is a passive rotation of the ankle, which we can compare with later after we've treated the tissue to see if we've made progress. After we've done our assessment, we can treat the tissue. Sometimes we may start with myofascial release if the fascia of the client feels tight or restricted. This is usually just a light to medium pressure with no oil and maybe a light stretch in the ankle as well. After that, we might add some deep work into the muscle belly as well as some friction, maybe in the tendon of the Achilles. For this, we'll add some oil. As we treat the gastrocnemius, we're feeling for any tight spots and getting feedback from the client so that we can treat the tissue in the best way possible. Across the tendon, sometimes we'll do what's called cross fiber friction. Maybe some what's called pincer palpation. Or flat palpation. So from this angle, we can also treat the foot if there's any pain along the plantar fascia, any pain around the heel, sometimes typical with runners, depending on their gait. They may have pain in the arch or along where the toes come in. So we can treat that area as well from this angle after we treat, either before or after we treat the calf. Thank you for watching. This has been Pete talking about massage for runners.